Hi you guys, Andrea here with the Healthy Back Program. So I wanted to give you guys a biohack way to help yourself when you're having sacroiliac joint pain or SI joint pain. And basically that could be related to a lot of things. It could be related to arthritis, it could be related to issues that are nerve related, it could be myofascial in origin. Ultimately, a lot of times what we find with SI joint issues is that the sacrum, which is supposed to have some movement between your two pelvis bones, gets stuck. It gets hung up on a jagged edge, or it rotates just a little bit out of place and it needs to be realigned. And so when I have clients that are complaining of SI joint pain, I encourage them to do a lot of tailbone oriented type stretches and movements to try to help reset that sacrum between the pelvis bones. And so I'm going to demonstrate one of those moves for you here. And this is something that you can do lying down either on the floor or on a bed or a couch. I have my massage table here in my office, so I'm going to use that. And so this is something that you can do yourself. This is something that you can have somebody help you do. But ultimately what it requires is that you get in a lying down position, bring your knees up, and try to get your pelvis as flat on the surface as you can. So it's helpful if what you're lying on has a little bit of firmness to it or support to it. And then you're going to lift your knees. Now what's going to happen is you're going to be doing you're going to be trying to torque that pelvis. So if your pelvis is flat or straight like this, so if you're looking at me lying from my feet up, we're going to try to torque that pelvis. And we're going to do that by one leg is going to be going this way, the opposite leg is going to be going this way. So you're going to be doing this kind of movement. And then we're going to do movement where we bring the knees together. So we're going to bring our knees together. And then we're going to do movement where we're doing the opposite direction. So you need some resistance with this. And you can either use your hands to help resist, meaning if I'm bringing this knee up, I'm pushing against it so that I'm stopping movement, but I'm still having an isometric muscle contraction that is helping put force into my pelvis. And so if this knee is coming up this way, you're pushing this way, which means if this knee's going this way, this knee's going that way, your right knee's going opposite direction, so you'll be pulling. If you put your hand underneath your knee and you pull toward your head while you're pushing down this way, that's how you can provide resistance in this direction. And so the first move that you're going to do, you're going to bring your knees up. Let's make this knee go up and this knee go down. And so what you're going to do is you're going to, at the same time, up and down with those knees, and you're just going to hold this for a count of 5. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. Now you're going to put your fists together like this between your knees. Squeeze those fists together. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. Now we're going to do the opposite direction. So now we're going to push down with this knee, push up with this knee. For a count of 5, 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. And again, put your fists together and squeeze those fists. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. The other thing that you can do to help yourself is, if you have trouble remembering which way to go, this is a Swiffer handle. You can use a broomstick, you can use a stick, you can use anything that's long enough that you can get between your legs. So it's going to act like a fulcrum. So here's my right leg. I have this underneath my leg. It's going to be on top of this leg. And then I can hold on to both sides and do that push and pull with this. And you just have to change the positions to change the direction of the force. Those are ways that you can do that for yourself at home. What I recommend is that if you're having SI joint pain, that you do this maneuver along with some other tailbone related maneuvers, and then give yourself an hour or two to have that work kind of settle in and let things settle down. Oftentimes, you'll notice after you do this type of work that it may take a little bit of time to settle in. So give it a good, I'd say give it a good, 2 or 3 hours to have the work settle in before you try to do it again. But ultimately, the goal is to, again, if you're looking at your pelvis and we're trying to do that torque, so the pushing up, the pushing down, and then the pushing in, what we're doing is we are, if this is your pubic bone here, if we're pushing that pubic bone together by pushing the knees in, it kind of helps bring that top of that pelvis out, because the sacrum is a shape like a diamond or a triangle. It helps open the top of the pelvis and kind of let it reset when you relax. And so the goal is just to get the pelvis bones to move and open and allow that sacrum to settle in between like it's supposed to be. That's the goal of this maneuver. Anyhow, I hope that's been helpful for you. I will see you in the next video with the next biohack on helping you help yourself at home.